All right. Welcome, everyone. Thank you for joining us for our November Ascend webinar. This month, we have Del Mackey, Senior Economic Development Officer for the Arrowhead Center at New Mexico State University. And he will be discussing SBIR and STTR Phase II and how it helps you move further down the commercialization pipeline. Mr. Mackey will go through his presentation, and then we will leave about 10 minutes at the end for questions. Please send them through the chat feature, and we will read them out loud. Thank you, Mr. Mackey.
Oh, thank you very much for the introduction, Haley. And good afternoon, everyone. As Haley mentioned, today we're going to talk about the SBIR and STTR Phase II program as it relates to the National Institutes of Health. Real quick, a little bit about me. So I'm a member of New Mexico State University. I actually work at the Arrowhead Center, which is the Economic Development and Intellectual Property Office for the NMSU system. And I'm part of the NM FAST program. So we are a FAST awardee, which is the Federal and State Technology Partnership Program that is administered by the SBA, who also administers the SBIR and STTR programs. And our entire purpose is to actually help small businesses, typically in New Mexico, as well as faculty researchers understand more about the SBIR and STTR programs, their value, how they help people actually move forward from an innovative idea towards a commercial product, and really what are the steps necessary, how do we assist people, what is all required, because a lot of times with these programs, the information that you have to put together, what you have to do, how you get your forms, how you fill it out, how you create a proposal, can be really challenging, really mystifying. It's a thing that not a lot of people are really successful with. So today we're going to focus really on that phase two and some of the differences that NIH requires between a phase one and a phase two and what you should focus on. And we're also going to talk about some other kind of companion opportunities that are available. And then we're going to talk about a very special program we run that is open for applications now for any university faculty or any small business working with the university from across the nation. So we're going to discuss that and then leave about 15 minutes for some questions and answers. So most of this information, at least at the beginning here, should be very kind of Nash for people. They should already understand it, but just in case, with the SBIR and STTR programs, they are federally funded programs. They're non-dilutive funding, which enables someone to kind of develop their idea, test out that feasibility, and make sure it's going to work before they dump a lot of money into R&D on a prototype that may not have a customer fit, may not be able to get to market, and may lack the necessary resources, or the necessary resources could just crush someone as they try to scramble and get the money together for R&D. Because R&D is expensive. For a lot of businesses out there, they spend a large portion of their budget each year for R&D purposes. But the entire focus of these programs is really to grow innovation, to see innovation forward, to make it so that entrepreneurs and small businesses out there can get these new, unique, a lot of times revolutionary and groundbreaking technologies into the commercial market, into a market space, into the customer's hands, the people that are actually going to buy it, that actually have some value or have a value proposition that is being met, something that meets their need that is currently not being covered. And a really interesting aspect for these programs is it does allow for small businesses to actually work with research institutions. And so research institutions like federally funded labs or universities or nonprofits, colleges, things like that. Really just anybody that is receiving federal funding to do research and development many times is considered a research institution. And there's a little bit of a difference between these. So with the SBIR program, it is really all about that small business. They can completely take the idea forward, or they can actually bring in subcontracts with, other small businesses, larger entities, nonprofit organizations, those research institutions that can help them see their idea forward and can help them validate that feasibility of it. Can this actually work? But there's also another program, the STTR program, which is very beneficial if they need a lot of research that they just can't do in-house. It does allow for research institutions and universities to actually get more of the funding than is allowed under the SBIR program, because there's hard caps to those levels of funding and that level of work that can essentially be, farmed out to someone else. And then there are 12 agencies, technically 11 agencies, 12 departments that operate under the SBIR program. Out of these agencies, 5 of them also do the STTR program because it is a little bit more research effort. There is a little bit more validation that goes into it, and it receives a smaller pool of the funding, you could say, but it is also a very great source of funding for a lot of these businesses and a lot of these ideas. And this is just kind of an overall glance at the different agencies. A lot of times there is some really great cross communication and development that goes on between the agencies. One thing to note is that, you may have had an NIH Phase I under an SBIR, but you're not locked into that program and you're not locked into that agency. When you go to move to a Phase II, you can actually switch agencies. If somebody else's research focus really aligns better with what you're creating, that product that is going to, hit the market, what you're going to move forward with, you can actually jump between agencies. And if it comes out that more development needs to be done by the research institution, or they're actually going to take a technology forward, the business is going to license something from the research institution for that Phase II, you can actually move between the SBIR and STTR programs. So once you get into that, pipeline, you're not locked into just developing under one agency or developing under one opportunity type. You can freely move back and forth between them as it makes sense for the future of the product. But the focus that we're going to do here today is on the National Institutes of Health and how health technologies essentially move forward through this process. So with NIH, the NIH program is actually run out of the Department of Health and Human Services. That is the overarching umbrella agency that funds this program. But if you go and search for HHS SBIR, you're going to go nowhere. Typically, you have to Google NIH SBIR to get anywhere. And there are 27 institutes and centers that participate in NIH. And out of that 27, 24 of them actually offer funding opportunities for SBIR and STTR. The big key thing to think about with that is each one of the institutes and centers under NIH will actually focus on a different area of science, a different area of health, a different area of, bioinformatics, whatever it is. You have institutes and centers such as there's one for Alzheimer's sufferers, there's one for AIDS research, there's one for the National Cancer Institute is actually a really big funder for SBIR and STTR because typically cancer drugs take a long time to develop. They need a lot of research. They need a lot of setup. And each one of those institutes will typically focus on a very specific part of health science. And the reason that's kind of relevant is when you look at what they have for the omnibus, it just gives you some basic information. But digging down deep into those different institutes, what they focus on, what they're relevant to, might have higher levels of funding and a longer period of performance for something like a Phase II than the assisted living or some of the alternative medicine ones. It's really just kind of up to those individual agencies when they release those focus areas and those topics, those overarching domains of science that they want to look at solutions for. Along with the different institutes and centers, Actually, the Centers for Disease Control, the Food and Drug Administration, and the Association, I think it's Association for Community Living and Children and Families also participate in this program. So those opportunities are a little bit separate, but you still answer the same call. And one thing that's really great about NIH is they are very aggressive in supporting innovation. Out of all of the agencies, the National Institutes of Health have some of the best companion programs. They have some of the best complementary opportunities that can help people get over that hump, or what is typically coined the valley of death, when people move from that phase 2 to phase 3 of development, where they move from a prototype to a market-ready solution and something that they're actually selling. A lot of times people don't know who their customer is. They don't know that, value proposition. They don't know those actual benefits and why people will pay for those benefits. And that can be critical as someone moves towards that market and tries to sell this solution. And we're going to go over, those opportunities and why they matter here just in a little bit. But one thing to also keep in mind is that because these programs are set up for business development, the main awardee is always going to be the small business. The principal investigator on the application and the award can actually come from a research institution, but any of that funding is always going to be considered a subaward or a subcontract between that small business and that research institution. So if you are you faculty and you're working with a business, just kind of keep that in mind. Is if you're the PI, you can largely drive the project, you can largely drive the focus of research. But at the end of the day, the person kind of calling the shots is always going to be the business, because they hold the contract, they hold the award. So real quickly, kind of just an overview about phase 2 opportunities. So in a phase 1, you're really looking at that feasibility. Is this workable? Can I make a solution with this? Is this a problem I can actually solve? You're doing a lot of basic research about it. Can this happen? Does the science actually play out? And then in the phase 2, they're really designed to build on the results of that phase 1. So my testing, my validation, my research that showed me this. Now I need to create kind of a market-ready prototype for it, something that I can demonstrate to somebody and say, see, this works. It will do what I said it does. And I can show you. I can put it in your hands. You can actually, play with it if it's a biomedical device. And because it is moving towards that prototype, there's a good amount of funding that goes with it. It's typically about typically about $1 million over a 2-year period. But again, different institutes and centers might have different levels of funding. They do actually have waivers on certain topics where they can go 50% above the funding ceiling. So it's always important to kind of dig into that. And the reason it's great to kind of dig into that is, if there is a center that has a better opportunity where you can speak more towards their problem, you might be able to get more funding through there. You always go, where's the biggest bang for your buck? And you can actually submit a phase 2 proposal, even if you are still in the middle of your phase 1 award, as long as you can show that you've established some sort of feasibility for the idea. But if you finish your phase 1, you need to sit on the results. You may need to do a little bit more research. You may need to actually get some ducks in line. Then you can wait on it, but you have 6 submission periods before you can or have to actually go back to the program manager and say, I wasn't able to get this together and this is why. And for NIH, 6 submission periods is a 2-year. So once you finish that phase 1, essentially you have up to 2 years to submit that phase 2, before you're going to have a lot of explaining to do on why it took you so long to get to where you were ready for a phase 2. So for the meat of the phase 2, which is kind of always one of those things that's very important, really quick, because it often confuses people, when you go into the assist system to actually submit it, you're going to have to mark that it's a renewal. It's technically not a new award because you are building off of the previous award. And you're going to fill out a lot of those same forms. So within Assist, there's a way to copy the previous forms and to copy that submission. And that's always recommended as long as there's no major changes, because then you're just going to fill out a lot of those same forms, like your human studies, your animals, vertebrate animals, and the euthanasia plan for them. Any of those weird forms where you had to check a box and provide an explanation, you're going to have those same ones. So it's a lot easier to copy it. But between the differences between the Phase 1 and Phase 2, the forms are all going to be the same. A lot of the setup is going to be the same, but you're going to dive a lot deeper into the need. You're going to dive a lot deeper into why this is something that has to get to the market. You're going to dive a lot deeper into, I actually validated this. I showed that it works. Let me tell you why this is interesting. Let me tell you why it's important. Because the big documents are still going to be that kind of research strategy, except instead of having 6 pages, now you're going to have 12. And kind of out of the blue, you're going to have a 12-page commercialization plan. So how are you going to commercialize this? What is the pain point it addresses? What is the competition for it? Who else is out there? We're going to kind of go through a lot of those items one by one, but just keep that in mind, is that a lot of the commercialization stuff, because you really didn't have to have it for that Phase 1, you just had to have a really brief overall idea. A lot of this stuff you're going to have to generate from scratch. So while you're working on your Phase 1, while you're out there, while you're potentially meeting people, potentially going to conferences, finding out more about what drives, the health behind, or the health, denigration behind the problem you're trying to address. Collect that data. Start setting yourself up for success. Because once you have that award that is closing out, it's a big, kind of undertaking to get that 12-page commercialization plan. If you haven't been doing planning, if you haven't been doing research, if you haven't been gathering data during your Phase 1, as you're going through and testing the feasibility, validating it, a lot of the data that goes into that commercialization plan, you'll kind of figure out. So, take copious notes. But for that research plan, again, it's going to go increase from 6 pages to 12 pages. Remember, in the research plan, that 6 pages really kind of dove into what is the innovation? So why is it important? Why is it unique? How is it revolutionary? How is it actually approaching health science in a way that nobody else has done before? And then you also have the significance. So how widespread is this problem? How many, lives are you going to save, or lives that you're going to change for the better? Why is that important? What does this, disease, or what does this illness, or what is this affliction that you're trying to solve actually do to people? Essentially, why should someone care? Why does it kind of pull at their heartstrings and go, we have to solve this problem. This is a critical health issue. And you had the approach where you kind of did that research plan. What am I going to do? How am I going to do it? Why am I going to do it? When do I know that I succeeded? Now, moving between that 6-page document to that 12-page document, you're going to have the same sections, but you're really going to focus there not on what am I going to do, but what did I do? So with the Phase 2 research plan, it's going to be, how did I succeed during that Phase 1? What else can be done? How do I need to move forward from those results? How do I, you already established that kind of credibility with the program manager when you had that Phase 1. They believed in the idea. That's why they awarded it. Now you're going to kind of nurture that. You're going to grow it. You're going to say, I succeeded here, and I think I can make it better by doing this. I succeeded here, and I can show that, my initial estimates were off, and I can actually impact a lot more people's lives. I succeeded here, and I'm going to build on the research by doing this. These are the things that I have to do to actually see this through to some sort of product. Because you're also going to have to tie it into how you're going to commercialize the results. So what is the product going to look like? What is that solution going to look like? How are people going to acquire it? Why do they want to acquire it? What does it actually mean to them by buying this? Or if it is, a healthcare provider, what does it mean to them by integrating this solution into their operations? And then you also have a new section of it, which is that progress report. So besides linking those individual sections towards what you succeeded at for the phase one and how you're going to grow it, you kind of have to provide a summary of what happened during that previous period. What did you do during that phase one? How did you just crush those specific aims that you had? Or if there were aims you didn't get to, what was the stopping point? What was the hurdle? Was it something that was simply out of your control? Was it poor planning? How are you going to succeed where you might have stumbled in the past? That's really what you're doing there, is setting up the idea that there were roadblocks, but I know how to get around them. There were, critical missteps, but now I've learned. Now I know how to actually move this forward. And, just really for some overall guidance, for a good research strategy, so out of those three sections, that significance, again, focuses on how pervasive the problem is and how it's going to change people's lives. There should be some aspect that is going to change. Why is that important? What does it do to people for, longevity of their health, or just making their lives better? And in the innovation, why is it revolutionary? Why did you figure out something that nobody else did? Why did you figure out the science? How did you figure out the science? What is it that is so unique about this that people are going to be clamoring for it and, beating down your front door just to buy it from you? And one key thing to remember that a lot of people overlook is when you're doing that approach, when you're doing that research plan, you have to have milestones for how you know that you succeed with the research. If you don't have a measure there that you can test and say, yes, this is feasible. Yes, I know that I can do this. Yes, this shows that this will more than likely work. When someone reviews the package, they're just going to go, well, are they just going to continue research on this one aspect the entire time? I don't see how they know that they're going to succeed. So always make sure to have a milestone that speaks towards that. Or sets of milestones if you have multiple objectives. Now, the commercialization plan, people will often overlook it just because they go, well, they kind of threw it into the phase two. We don't really talk about it in the phase one. We don't really think it's that important. And that's a misnomer, because the commercialization plan is vitally important to moving forward with your solution. The commercialization plan is vitally important to, kind of showing them that this can be something. Because remember, the entire purpose of these federal programs is to commercialize innovative solutions, to help them get to market. If you don't have a kind of goal of that market, or you don't have an understanding of what that market looks like, the likelihood of you succeeding with a phase two submission drastically reduces. You very briefly talked about that during the phase one. What is this going to look like? What is the potential solution going to look like when it gets into someone's hands? You're going to have to develop this a whole lot more. Because again, not only are you looking for the biggest bang for your buck, these agencies are looking for the biggest bang for their buck. So why does their investment? Because, at the heart of it, it is an investment. It's a non-dilutive investment. You don't have to give up part of the idea or part of the company, but it is investment by the government to make sure that these things get to market, that businesses grow, that businesses hire more successful people, that businesses pay people more, that businesses actually, take in more in revenue, because at the end of the day, the government is going to get more in taxes. So it is not a direct, dilutive funding, but they're going to get their ROI somehow. So show them how you can succeed. Show them how you can actually sell this, why they should be interested in helping this business continue to grow. And one of the kind of key facets, and it really does speak towards health, is knowing the difference between a customer and an end user. The person that benefits from the solution the most might not actually be the person that purchases it. What I mean by that is when you're dealing with health, a lot of times the afflicted patient is not the person that's going to be buying it. They're the person that's prescribed it. They're the person that it helps out the most. They're the persons whose lives you're going to make better. But a lot of times it's the insurance companies you're going to have to sell it to, or private practice providers. So kind of keep that in mind when you look at that, because you are going to have to talk about that end user and that buyer during the commercialization plan. Don't get the two confused. It's great to actually have two different ones as well, just as long as you show that difference and why that difference matters. Because at the end of the day, the value proposition is why someone would buy it versus the competition. And it's a fallacy to think that you don't have competition. We're going to I'll explain what I meant by that in a couple of slides here. So the commercialization plan does have 6 different sections. This is just a really high-level overview of those 6 different sections. I didn't want to dive down too deep into just an information dump for these, but just looking at these sections, what they cover and what you do is a good, just kind of brief overview, a summation of them. And they're things to start thinking about. You're going to have to know, what are the revenues? So how are you actually going to make money? How are you going to sell this? Do you have an overall idea of how much it has to sell for? That may not be something that you have currently, because you probably haven't built a prototype. You probably haven't actually finalized the design. You probably haven't figured out exactly how it needs to speak towards a customer need. But you should have some overall idea about, where's this going to live? Is it a solution that you're going to sell to something like an insurance company, and then they're going to prescribe it or push doctors towards it? Is it something that you're going to sell directly to a hospital, directly to a patient, directly to somebody that is an affliction sufferer out there? Is it going to be on the store shelves of every Walmart across America? Or is it going to be available through an online marketplace, because you have to sell it as a non-medical solution to get around FDA requirements? How are you going to sell it, and how is that money going to come back into the company? Those should kind of be things that you have an overall idea for, some just general ideas. Also, how are you going to protect the idea? So how are you going to actually seek intellectual property protections on it so that somebody doesn't steal it? So that somebody doesn't say, well, I found this, I reverse engineered it, I figured out how it works, now I can make it on my own. I don't have to go to the company. I can make these and for pennies on the dollar in Shenzhen and start selling these. So how are you going to make sure that that doesn't happen? What are the steps you're going to go through? And also, one kind of key thing to remember here when we talk about intellectual property protection is directly paying for patenting something is typically an unallowable cost across every phase and across every agency. But there's ways to get around that. And some of the companion programs that NIH offers are really great ways for that. They can actually help offset the cost. A lot of times they'll pay for pretty much all the costs for going after a patent. Because believe me, being part of the patent office as well here at NMSU, I know patents are something that take a long time to get and take lots of money. So is it something that you can have NIH pay for through one of these? But just actually knowing what are the steps you're going to go through, how you're going to protect it, is a big part of your commercialization plan. And, again, just knowing that market, that customer, and that competition is probably the thing that you need the most set in stone. For that phase 1, you had some general ideas. You just kind of had a really quick overview about, well, I think the market is this because. You're going to have to validate that market data here. Why is the market that? What is the trend for the market? How has it grown? Is it stagnant? Is it not growing? Is there new research out there that says that maybe this illness, or, maybe this, let's take current example, maybe this pandemic is providing so much economic stress and affecting so many people's lives that this market is going to explosively grow over the next 2 years, because that something's not going to go away. Even if they have a vaccine, there's still going to be after effects. The vaccine's going to have to propagate, going to have to get that herd immunity. So what is that time period? How are you going to capture that time period? And, it may sound, vulturistic to do that, but the company has to be able to grow. It has to be able to sell something. It doesn't mean you're ripping people off, but they're going to pay for something that's actually going to affect their lives. So why are they going to pay for it? Knowing what is that big proposition for that value, that need that you're going to actually address, that pain point, the thing that keeps them up at night. Why does it keep them up at night? What is that solution? Sorry, barking dog in the background. I need to go strangle. And also, who's the competition? What is the competition? Remember, we talked earlier that a lot of people sometimes will say, well, I don't have competition. This is revolutionary. There's nothing like it out there in the world. And, to be perfectly blunt, that's totally wrong. Everybody always has competition. They may not be, so someone may need a product, and it may just not be out there. So you may have that product that's going to really meet that need. You're going to say, well, there's nobody out there doing this. People are going to be driven to this. And that's a valid point. You have something that is not out there on the market currently. You're treading new waters. But people are still solving their issues in some fashion. Are they doing something that isn't a great solution, but, may fit their need? Are they just ignoring the problem and sweeping it under the rug? Is it that much of a critical issue that they can ignore it and just go, well, it's not really affecting me, so I guess I'll just stick with this way? Sometimes that is the competition. It may sound strange, but I always like to use the example of Jurassic Park. So you had, Jurassic Park, and Dr. Hammond came up with this thing that was not out there in the world. Go and play with the dinosaurs. To really bad effect in the movie, but he had something nobody else had. But he wasn't competing with other dinosaur parks. What he was competing with were things like movies, things like Disneyland, things like even books, television shows, entertainment. Because at the heart of it, his solution was entertainment. He was driving people to a particular place to be entertained. So you kind of often have to, times have to think about your competition in a much wider scope. Just because you have something that isn't seen on the market doesn't mean that there's something that's not already competing with it. So kind of keep that in mind when you think about the competition. People are solving their problems somehow. How are they currently solving it? And how are you better? Why are you better? Why will people pay for that difference? That does get into that heart of what you cover in the competition. And also just having an overall view of the company. So what is the purpose of the company? Why does the company exist? Why are they feeling the need to move this towards a commercial market, to move this towards the marketplace? What does it actually do for the company? Where does the company want to be in 5 years? Having some amount of guidance about that, some amount of thought, some amount of what is this going to do for the company? Why is the company actually, continuing with this idea? How's it going to make the company successful over time? You have to have a little bit of that within that commercialization plan. But remember, all of these things are not set in stone. Even right now for a phase 2, really these are your best guesses. Your market data could be invalid, 4 days from now because something major happens. But it's no fault of your own. This is your understanding. This is your thought. This is your initial ideas. They don't want to say that, okay, well, you said that the company was going to grow this way within your proposal. If the company doesn't grow this way, we're going to sue you. That's not how it works. It's just, what are your feelings? What are your thoughts? What really drives you forward? What really drives you to want to solve this? What really drives you forward and wanting to see this, issue or problem be addressed? Why is it personal to you? It's those kind of things that the reviewers in NIH really look for, because it does put that kind of heart towards it. It shows that this is something you strongly believe in, or this is something the company strongly believes in. They've done this research. It may not be the best research, it may not be the most critical research. And research here, I'm talking about market, not your other research. But what did they put together? Why do they think it's vital? And why do they think it's important? Those are all things that need to be stressed within that commercialization plan. Because for many people, this commercialization plan is the thing that can be a make or break. When they review these, there's kind of two facets they look at. Half of it is about the technology, about the innovation, about why it's unique and revolutionary. And the other half is the commercial. So what is this going to look like? Why are people going to buy it? How many people are going to buy it? What does this do to the market? How is the market going to change? Can this spawn companion products? And one of the things that people often get thrown off by with something for commercialization is they go, well, but I'm not building anything. I'm not actually, creating something. I'm not going to have a product. But that's also a fallacy, because at the end of the day, everybody has a product. It doesn't have to be a physical good. It can be, a service. It can be a process. It can be an intangible good. It can even be a license. So maybe you're doing research in a biomedical device, and it's going to affect, paraplegics. I don't have data on how many paraplegics there are, but it's going to make their lives so much better. But you don't have the means to manufacture it. And they go, well, then I don't have a product. But you do. The intellectual property is also a product. So even if it's something that you're not going to build yourself, even if it's something that you're not going to take forward, there is always an opportunity there. And things like licenses, things like partnerships, things like agreement, that is still part of that commercialization. So even if you're not building a physical thing, even if you're not making it yourself, there's still opportunities to commercialize it. Again, through things like licenses, partnerships, agreements. Somebody else can move this forward to the commercial market, but that doesn't mean that you don't have a commercial plan, because your commercial plan is, how are you going to market it for licensing? How are you going to shop it around? Who's going to be interested in the license? Why are they going to be interested in the license? Those are all different ways you can kind of think about that commercialization, because they also want to see that there's going to be some growth outlets for the product, that it can move forward, that it can go forward, that there's something else out there. And there's also some programs by NIH that can really speak towards that, like the Niche Assistance Program, where they have people come in that have experience with this. They know what the commercial possibility can be. They can do that market data, that market dive for you. And this can be a great program to get you ready for that phase 2, to get all of that information to you that you need and that is possible. Also, iCore. So NIH has their own brand of iCore, where you actually go out there, get in front of customers, find out their pains, find out what drives them, find out what they need, and you tailor the product towards the customer, because you can never tailor the customer towards the product. They have to see that you're not falling into that field of dreams of, I'm going to build it so they're going to come. No, what are you going to make within there? What are the concession stands that you're going to put in there that are going to drive people to visit your park? And there's also, as I mentioned, a lot of other opportunities at NIH. So you aren't just kind of stuck at the end of that phase 2 going, oh crap, I don't know what to do now. There's things like the phase 2B, which it really does address that valley of death. It shows that there's some more research, or there's some more development that needs to happen. And the funding levels are kind of the same as what they are with the phase 2. So if the solution needs to bake for a little longer, this is a perfect opportunity. You have like the commercialization readiness program, which further helps you figure out who wants this, why they're going to want it. And this one is the one that can actually pay for, intellectual property strategies, as well as pay for FDA approval. So the CRP program is a really great value to people that may need to go through FDA approval, may need to get something together. And then, things like the commercialization assistance program. These are all just thoughts and ideas about, once you finish with that phase 2, how can you continue to move forward? What is funding available? And luckily under NIH, there's a lot of funding that is available. And I would be remiss if I didn't mention like the National Science Foundation, just because they are one of the only other agencies out there that does fund health technology. The NSF kind of proposal creation is very different than the NIH one, but if you see a better fit, a better kind of need with NSF than NIH, it's a really great way to move forward. And this just has a little bit more about NSF. The thing to know is that NSF for their phase 1 are a lot more focused on that commercial possibility than NIH. You do have to have some really great data about the commercial potential for it in that phase 1, and you're going to have to really expand on it for something like a phase 2. So knowing that commercial potential and that possibility, even for both, both for NSF and NIH, is vitally important. This is just more proposal requirements. So for now, a lot of people's heads may be swimming and they go, well, this sounds like it's overbearing. I don't know where to get this information. I don't know what to do. So we have a program that is called the Arrowhead Center SBIR Accelerator. We actually have an NIH one upcoming. Dr. Jared Bushman joined us here today, and in a couple minutes, he's going to talk about his experiences with that program. But the program was set up to really help people move through the proposal creation process. So our upcoming cohort is a 12-week cohort. It actually helps people figure out, what do I need to do? How do I get all this documentation together? What's important? And people can either do a phase 1, a phase 2, a direct to phase 2. We don't actually lock it down. Each week, people will meet with industry experts as well as our staff to kind of go over a developmental process and pipeline, where at week 1, you may not know what you're going to do, but at week 12, you have that complete and compelling proposal package to actually submit. And we'll make sure to send out the link for the applications right after and the digest that goes out after this. But the applications are now open. It closes on December 4th, and we'll send out notifications on January 8th for people. It'll run right up to the submission window in April. And in that submission window, we will actually sit over your shoulder, go through all of the process, make sure that your submission actually gets in on time and everything is required. So I'm going to let Jared actually talk about his experiences in the program now.
All right, can you hear me okay?
Yep.
Great. So I'm happy to be here to support this program. I was helped out in so many ways from it. So for context, I'm a university professor with some pretty decent, I thought, experience in patents and in writing proposals to the National Institutes of Health. Through the process of this program and getting my phase 1 STTR submitted, I discovered I was really naive. About 25% of the experience that I had with NIH proposals actually translated to the process of preparing and submitting phase 1 and STTR proposal. There are a lot of aspects to this which were entirely new to me. SAM registration, grants.gov, getting an ERA ID for your business, not just having one for yourself. The ASCA program was incredibly helpful. It's about 12 weeks, so every Tuesday. I don't know what to do with my Tuesdays since it's over, Dan. In the seminars and tips, a lot of information that I got just about basic criteria of, how do you want your letter writers to write their letters of support, the scope of the proposal, allowable costs, development of budget, a lot of help developing my organization. I have a startup, but it's essentially virtual. And so what sorts of organizations look good and are okay to have within the proposals? And this was entirely new to me. And the team went through several rounds of review with my proposal, and what we eventually handed in was very different, or submitted was very different than what I started out with. The budget is just a different beast altogether than what I was accustomed to. And then, finally, I have a clear memory now of the last few days heading into submission. Dan probably remembers this too. He encountered despite being ready, several days beforehand, there were several strange and perplexing issues leading up to the eventual successful submission, and needing days to kind of work our way through some of those issues about, one little tiny thing that was entered correctly, but something had to be changed to get it in there. So I'd like to lend my support to the program again and just say how helpful it was for me. I feel pretty confident at this point that I could put together and submit another one on my own, but I never would have been able to do that in the first place without the help from the weekly seminars, and then especially the one-on-one help with Dale and Dan.
All right, awesome. Thank you, Jared. And we were definitely glad to have you. And, the experience that Jared talked about, that's experience that all of the, participants get. As Jared talked on this slide, you saw some kind of data about it, but it does really help people move forward, and for getting the information together, for kind of just knowing how to approach stuff. How do you actually pivot? How do you change what you're doing, and why those changes are important? And then again, it is that 12 weeks. It is that kind of step in the progression for getting all your documentation together, knowing what's important, knowing what to submit, and knowing how to get this. We'll have more information when we send out the email about it. But I'd also be remiss if I didn't talk about an upcoming event that's going on. It's not NIH focused, but it is SBIR and STTR focused. So kind of figuring out, is there something else you need to do? Hearing from experts on things like commercialization, on the differences between granting and contracting agency. We have a free, what we call our Innovation Summit. Again, it's free. It's all going to be virtual this year, thanks COVID. But we have been able to pivot it, and you'll have the opportunity to kind of meet one-on-one with some federal program managers to talk about what you're doing. Is there a fit with what they have? Is there something that's kind of key that they need to know about what you're working on to make that decision? So highly recommend the event. We're actually putting it on. It's a lot of work for me on the back end with getting it set up, but it's something that if you have free time on December 9th, you can just kind of pop in, see what's going on, kind of connect with other support organizations that may be in your state, that may be able to help you with your submission, that may be able to help you pull together your proposal package, because it is going to be a focus across the nation. Going to have exhibitor booths by a number of support just organizations and helpers from a bunch of different states. So hit our website here, find out more about it, and then I'll make sure that people get a link so that they can just dive into it and see if it's something that they want to attend. But at this time, I'd like to open it up for Q&A.
All right, thank you, Del. That was a very informative presentation. I'm sure everyone got a lot out of that. Yeah, like Del said, we're going to move on to questions. So if you have any, please go ahead and post them in the chat. We do already have a couple questions, so I'll go ahead and read those out now for you, Del. John Hansen asked if you have any advice for someone who already has an advanced prototype.
So if you already have an advanced prototype, one of the things to potentially look at is the NIH Direct to Phase II program. So if you don't have a Phase I, if you've never had an award, but you have an advanced prototype, the Direct to Phase II actually does skip over that feasibility because you have to demonstrate that you've already done the things that you would have done in a Phase I. So the Direct to Phase II essentially just lets you skip that Phase I process, get right into that Phase II, start changing it, start developing it towards a specific, market opportunity and towards that specific customer value proposition. And then, it's always one of the other things too that maybe you do have a solution, maybe, it's already out there, maybe people are already buying it, but it could be better. You could, greatly modify it to actually meet more needs. So there is also the opportunity there. As long as you're, researching a way to have much greater impact, to have much greater, presence and significance for what you're doing, that's also a great opportunity even to kind of look at it and rethink it from the drawing board. So that would be what I'd really suggest for something. If you already have an advanced prototype, look at that Direct to Phase II, or look at what other research needs to go on. How can you change it? How can you make it more revolutionary? Because there is the opportunity there.
All right, thank you. We have another question from Kelly Drew. She asks, the results from her Phase I STTR show that she needs show need for more refinement. Is there a strategy for further Phase I funding?
So there's not really a strategy for further Phase I funding because you're kind of going to have to start over with a Phase I. It is really great in those applications, though, to talk about what you learned. So if the Phase I wasn't successful, you'd have a different Phase I, or maybe the Phase I was successful, but, again, like Kelly needs, you need some more development. Maybe there's a different issue you look at. And so, besides moving towards the Phase II, there's no real additional opportunities for a Phase I a lot of times. But what you can do is you can actually relook at what you did. You can relook at the problem you're trying to solve. You can relook at the research that needs to be done. And as long as it's for a different purpose and maybe there's different research, that overall idea can still be funded under additional Phase Is. Because you are pivoting, because you are changing, because you are realizing that maybe there's something else that needs to be solved. Maybe there's a different solution that needs to come out of it. Or maybe during the Phase I, you figured out that, okay, I showed that this is feasible, but if I could show that this is feasible, it's going to make it a much better solution. So as long as they're not essentially equivalent, like you're just copy and pasting the work and saying, I need more funding to do this, as long as there is that large difference, that differentiator, that thing that makes it unique all on its own, that's a really great opportunity to kind of further think about it and further refine it. When we give these presentations, a lot of times we get into, products that come out of it and success stories. And the one that I always like to throw out for people is iRobot. The people that make the Roomba vacuum, they got started off with DoD funding, but it wasn't to create a vacuum. It was actually to create EOD robots. So they needed to figure out, how does this move? How does it navigate terrain? How does it stay upright? How does it actually recognize obstacles? And they got multiple projects to figure out those individual components, those things that were going to make a much better product at the end. And they used that knowledge, they used all of that information, they used that research to come out with that little vacuum cleaner that, you see YouTube videos of it falling down flights of stairs. That was all through SBIR funding because they kept looking at different components and different pieces of that innovation and saying, I have to figure this out for this specific problem. I had to maybe go back to the drawing board or, maybe further refine what we're working on to make a better product at the end. So if you did have that phase one and you need further refinement, that would be my biggest piece of advice is, for that refinement, look at how you need to pivot it, how you need to change it. What is different about what you're going to do? How different is it? And if there is a good amount of difference, apply for a phase one for that difference.
Great, thanks, Del. That seems to be it for the questions in the chat, but I actually have a question that I had while following along. You mentioned the milestones for showing feasibility of your project or your product or whatever you were working towards. Can you go into a little more depth on that? Are these kind of smaller milestones that you can easily reach, or are they supposed to be kind of bigger milestones to prove more overall and big picture stuff?
I would say they could actually be either for a submission. So it really depends on the research that's going on, what's actually happening, and how it's going to make a product in the future, how you need to establish that innovation. As long as, you can have the large milestones, you can have the big milestones, but just having some goal that you're going to try and hit, knowing what that goal is, knowing how you're going to measure it, and knowing how you're going to validate it is much more important than whether it's a small milestone or whether it's a big milestone. From the funding side, they're not going to care about that milestone difference. They're really going to focus on, do you have milestones and do they make sense? Is it something that somebody from the outside could look at it and say, okay, I see why they think they need to do this. I see why they created this. I see why it's kind of that stop point. And really with the milestones, they should almost be that stop point where you're moving through these different aspects. You're doing this different research. You're doing this different discovery and saying, okay, I'm going to test this. And if I get a result that says that this new cell wall gets greater than 20% penetration by this protein, then I know that my solution will more than likely work. Because again, particularly with your milestones and even in a phase one, you're not getting all the way to the goal. You're not saying that I showed that this will work 100% of the time, every single time. No, it's really your best guess. It's being able to show and establish that this is something that potentially works. I've shown that, under certain conditions, this will work. Under certain testing, I can reproduce this. And that's really kind of the big thing with those milestones, is just knowing what is that stop point where you say, I got a pretty good idea that this will work. I can explain how it'll work. And as long as it's, you can explain it, as long as you can, demonstrate that it will more than likely work, let's just say 51% of the time or greater, then that is a true milestone that they look for. That was kind of circuitous, but I hope that answered the question.
It did, thank you. And we actually had one more question come up from Megan Stark. She asked, is hub participation and involvement highly selective or competitive? Maybe more of a question for our end.
Yeah, I would say probably, because, from the NSF standpoint, as long as you know where you're going to go and as long as you can demonstrate it, I don't think that there's anything that, from their end is going to flag, oh, well, you were part of this research group or you were part of this. But however, if it is something like a research group, if it is something that's been put together towards a specific area, towards, specific solution set, and it shows that coming together of the minds, that does help to establish that credibility. Because remember, with these proposals, at the end of the day, you're sending it out and you're sending out the best thing and hoping that someone believes you. So what can you do in these packages to make sure that if you handed this off to your neighbor and they read through it, that they believe you can actually do it? They may not be the most scientific person. They may have ate paint chips as a kid, but if they can read through it and go, I think this can actually work. I think you might be the person to do it. That is what you're trying to do. So showing, how you came together, showing how you move forward, showing, the partners you have, the potential out there for growth, that you have other research, entities that want to help you with this. That shows that there's somebody else that believes in you, and you've established that credibility. And it goes a long ways towards establishing credibility with NIH reviewers.
Great, and Hallie, I'll just pass it off to you to end the webinar.
Awesome, thanks, Michael. Thank you, everyone, for joining our November Ascend webinar, and a big thanks to our presenter, Del Mackey. The recording for this webinar will be on the Ascend website, ascendhub.org, by next Monday. Also, please join us next week on November 19th for a virtual conversation with the Director of the U.S. Patent and Trademark Office. You can find the registration link on ascendhub.org. Thanks again, and have a great rest of your day.